there are many things that we do here, and we have multiple providers. You know, we have another Dr. Lou and PAs. We have Elizabeth Money and Tan Nagayan, and we also have another nurse practitioner, Terry Brennan. So we have many, you know, different people with different skills. I see general dermatology. I see pediatric dermatology, being board certified in that, and see a lot of kids. And then I also do dermatopathology, where you look under the microscope to look at the slides. One of my main interests, though, besides those, is hair loss of different types. And that's even the type with where they lose all their hair, even a young kid, or they have patchy loss, or they have scarring type loss, as opposed to the usual routine, you know, male pattern hair loss, which I suffer from. So that's one of my main interests as well.
And are you able to share any, you know, notable success stories with patients across the spectrum of treatments that you provide?
Yes, you know, many different things. I will tell you that in terms of the hair loss problems, I am referred by other dermatologists to my office to see a lot of those patients who, you know, we have really cutting edge information on that. And in fact, some of the newest things that are out, there are 2 new drugs that have been found to help these patients with total hair loss. That is called Alopecia Areata, and that's miraculous. Some of them have had no hair for 20 years, and then they take it, and within a few months they have hair regrowth all over. You know, it's great. It's really you know, very cutting edge news with it. And you know, many you know, success stories, I would tell you, is what you asked for. I have many patients who I think have failed to realize that they have hair loss. One of the things we see in women is frontal fibrosing alopecia, which they lose their hair, moves back like this. But there's very good treatment for that. One of them is this hormone blocker called Avodart or Proscar, which is very effective for that. And that's really just in the past few months that we know that that is probably the best way to go.
And as far as the hair treatments that, I mean, within the treatments that you offer, do you have any treatments that are like you just do one session and then you're like cured effectively?
That would be nice. Generally, no. Generally, with hair loss, it's a little bit more complicated, so it takes some other time. If they have some other lesion, many times they can come in, we just numb it up, take it off, and then they're gone, and then they're finished. And, you know, Botox we do, cosmetic, other treatments as well. And that's, you know, one time and you're good for, you know, 3 to 6 months or whatever. And other fillers and other different type of laser treatments to get rid of blood vessels or to help reverse the wrinkling and things along those lines. So some things are kind of one-shot deal, but usually I like to see them back for follow-up anyway to check. So if they want to be resistant about it, they could just come in and get that done and then it'll be done. But usually you're watching them along.
Okay. And when we talk about, you know, achievements and awards, could you name a few over the years?
Well, many. I'm sorry. You know, maybe for you, sorry to say that I just, yeah, I'm in the this Molly Begain association, which is the Molly Begain Fund, which is a young girl who passed from melanoma, but her parents are very involved in that. So I'm in their news because I go to the local school over here, the middle school, Garden City Middle School, and talk with the kids, and you know, we have other videos and even rap things that we do with them. So that's very nice. I'm also happen to be in Dermatology Times. I guess it's going to be next month. That is, you know, they asked me about a type of hair loss problem called erosive pustular dermatosis, very uncommon, but to ask me just the information on it to try to let other doctors know about that as well. I've also been I have a citation from the Nassau County, or town of Hempstead, as for my public service, because I've gone to beaches, we give out sunscreen, we do a lot of work along those lines. And then also personally for me, I just again took my renewal for my boards for pediatric dermatology, so I just got that, just passed that board certification for renewal. After 10 years you renew on those, and those are the main things right now.
So the board certification means that you can practice in all the states of the U.S.
Board
right?
certification means that you have gone through the training that you should have, that you've gone through approved training programs, and then you also pass the test afterwards to show that your knowledge base is adequate or superior to be certified. So in order to be board certified, you have to do all those steps in order to get the board certification. That's really the highest criteria that is used for a doctor. And then I have that in 3 specialties.
Okay. Oh wow. Okay.
Yeah, that's good.
Doctor, what would you recommend prospect patients to come to this to you?
Well, I would tell you the first thing is that we don't rush the people out. We try to do our best. We have a very fine staff. We have a lot of RNs and LPNs and physician assistants and nurse practitioners, and we work together back and forth, to try to address people's problems. Second of all, I think I've been around for 27 years, so I think that's good to have somebody with a little time under their belt. And also that we have many different treatments for many different things. This is just one of our lasers here. We have all different light boxes and lasers for psoriasis and for white spots for vitiligo, and we have hand-foot units, and we have other different types of vascular lasers for blood vessel growths. We do just about everything. We also have Dr. Liu, who is our Mohs surgeon, which is a special type of skin surgery for cancer. So we are kind of one-stop shopping, and we do just about everything, if not everything.